Hello, we are back. It is another day and another video. Kind of a gloomy day here in Wisconsin, so we are holed up inside today. I thought I would make this video. Today's video topic, it is ICD replacement surgery. Yes, I just had an ICD replaced, actually about almost exactly a week ago today. So if you happen to have your own ICD, or maybe you're thinking you might have one coming in the future, you might want to stick around. There could be some valuable information in this video. Admittedly, I do look at this world through a little bit different eyes than a lot of people do, so you will get a slightly different angle, but I think that can be very helpful to you instead of always just seeing the same information presented the same way. This video, it's gonna kind of be 3 parts. Obviously, it is titled ICD Replacement Surgery, so we will definitely talk about how my surgery went and how it is still going. I also want to bring up, I was questioning going through with this for many years now. I was pretty adamant that I was almost not going to go through with it, but we will talk about that, and I will talk about why I ended up going through with it anyway. Now, before I get into the actual ICD surgery itself, I should probably give you a little backstory. My name is Joe. I am 51 years old, and I had my initial ICD installed about 9.5 years ago. Now, why did I have it initially installed? We'll probably get a little more into that a little bit later, but to keep it simple right here at the start of this video, basically, I have something called hypertrophic cardiomyopathy, and there was a few factors in there that made the doctors decide that they should recommend an ICD for myself and my situation. Another reason I ended up getting the initial ICD is because, here's the thing, guys, and I would like to address this, is I did not know what I was getting myself into. Like I said, this was suggested to me, but here's the thing. I was recently diagnosed with hypertrophic cardiomyopathy. Also, I've been dealing with AFib for years at this point. Frankly, I was kind of scared. Wasn't feeling that great at this current time of my life. Went in and met with my hypertrophic cardiomyopathy team, which was new to me. I met them for the first time on a Monday. I had this device recommended on a Wednesday afternoon, and by Friday morning I was getting prepped for surgery, and I did go in, got surgery. By Friday afternoon, there it was. I was a new ICD recipient. Is that the right word? Now, at the time, like I said, why I do have this, I was scared. I thought I was gonna freaking die maybe. So I didn't even think about it at the time. I'm like, yeah, go ahead. Let's put that thing in and let's move along. Now, I mentioned later in the video I was questioning having it replaced. One of the reasons is, after having this a few years, I kind of decided that I might have made a mistake getting it in the first place. And the reason for that is because I did do it when I was scared and I was lacking a lot of information. Maybe I already said it, but I did not know what I got myself into. But we will come back to that. For now, is there any other backstory you need? If so, hopefully it comes along later in this video. But for now, I did have the replacement surgery exactly a week ago, 7 days ago. And how was surgery going, or how did surgery go? I gotta say, I would say it was flawless. Though there has been one thing that has popped up, so I'm not gonna say 100% sure if it was flawless, but what came up, I'm not even sure it is tied in with the surgery. But let's start out last Monday. We went in. I am 2 hours away from home, where my main doctor is down there in Milwaukee, Wisconsin. And we went down there. I had to be there at 8 a.m. I think surgery was scheduled 10-ish, 10:15, something like that. So, starting out, I was in the room to get prepped for surgery. We had the prep nurse come in. She was doing her stuff. Now, here's the thing. I am usually a very hard poke. It seems to be almost impossible for somebody to get a good solid IV into my arm. And honestly, even standard routine blood work, it is often very difficult. What happens is sometimes I will leave a clinic or a hospital and my arms will be trashed. So of course, surgery coming up in the morning. I know they got to get an IV in me. I am not looking forward to that process. So I did tell my nurse I am notoriously a hard poke. So she gave it a whirl. She went for my hand. Here's the thing. My veins, they always look great. And they always tell me, you got some nice looking veins. And I usually don't say nothing, but in my mind, I'm like, yeah, well, those veins are not going to cooperate. And they never do. And I got to hand it to these nurses. They are generally pretty confident because when I tell them I am a hard poke, they seem to usually kind of ignore me and they kind of just go for it and they usually miss. So today, or last week, a week ago, she went in. She was going to put the IV. They had to get some blood as well. She fished. She was looking, asking me how I was feeling. She finally kind of got it. But she wasn't happy with it, and she told me this would be fine to get the blood draw, but she'll have to get somebody else to come in and try doing the IV. So I'm like, okay, here we go. It starts. So she drew that blood, took it out, and a handful of minutes later, a young nurse walks in, and she was all business. I kind of liked it. No small talk, no smiles. She just went to work, pulled her stuff out, bing, bang, boom, typed that thing down. It did hurt like hell, but she nailed it. She got it her first try. I couldn't believe it. So 2 shots, not so bad in my case. There's been times where they missed 14 times before sticking one on me. So immediately I would say that's a pretty good start to surgery day. So after that, I just kind of hung out for a while. I think they had to shave my chest. No big deal there. Dressed in all the hospital gowns. Them things are horrible, but it is what it is. And like I said, I think surgery was a little later, but I was still in there in the 10 o'clock hour at some point. Wheeled me back down the hall. Wasn't too far from my prep room. Went in there. Hopped on the table. Laid back. They put like not a sheet, but it was a blue hospital sheet, whatever it was. You know, they covered my neck so I couldn't see down below my neck, obviously, because this is where they were doing the surgery. Laid down, the guy put oxygen on me. He said it's not necessarily for any reason, just a little more comfort or something like that. You know, and immediately he said, okay, we're going to give you a little medicine for a little extra comfort as well. And, you know, I could feel the medicine going in. I think that's normal. I don't know. But I was still, at least what I kind of thought, completely awake. Just kind of hanging out there. But I must have been in and out, which I kind of realized after surgery. But at the time, I thought I was awake the whole time. Anyway, laying there for surgery and super comfortable with this medicine. I mean, honestly, I felt amazing. Maybe it's because I don't drink alcohol and I don't smoke anything. I'm a very clean living person, so that little narcotics kind of felt nice as I haven't had a good buzz in a very long time. So I was there, felt great during surgery. I mean, and the only thing I felt, it just felt like somebody was just kind of doing this. Just a little pushing on my chest area a little bit. And it felt good, actually. And I didn't think much of it, you know, a little poking here and there. I was mostly awake, I thought. I think I was in and out, but I remember a good amount of it. And before you know it, boom. They're like, we're out of here, we're done. I was getting on my thing and getting dragged back to my pre-op room. And honestly, I would say for sure it was definitely under an hour, maybe even 45 minutes. My wife was with me at the hospital, and after they took me to surgery, she went out, I think went to the cafe. You know, usually you sit down, grab a little snack or something, and she said she didn't even really get comfortable by the time she was kind of sitting down. They were calling her, telling her I was done. So she quick got up and came back in the room, and by the time she got in the room, I was already there. So I felt no pain. I felt no pain at this point. Basically, we waited in there just for a little while. I had to wait for my, I think it was an IV of antibiotics to be used up. So we basically waited on that I had the ICD company, which is Medtronic. One of the reps came in and he was talking to me about the device and stuff like that. Finished up with him, got dressed, walked out of the hospital. Like I said, I think we got there 8 a.m. I can't remember if we were out of there by noon. If it was afternoon, it wasn't much afternoon. So we were in there 4.5 hours, something like that. 5 tops, but I don't think it was that long. No prescriptions for pain meds or nothing like that. They just told me to grab some extra strength Tylenol, so we grabbed that. I did have to grab some antibiotics. I think I had to carry them on for another 5 days or something. So we grabbed them, went on our way. There's a big grocery store down there that my wife likes to go to. I was feeling fine. So we pulled into there. It was a beautiful 80-degree day here in Maine, Wisconsin. Felt terrific. So I just chilled out in the car. She went in, did her shopping. Again, no pain whatsoever. Obviously, you felt something happen there, you know. What I said throughout the week. Honestly, guys, I didn't experience any pain. Ever. Till this point. All it felt like here and there is it feels like there's a brick like inside of my chest. You know, the device is only yay big, but it feels like there's a whole large brick in there. But that's about it. No pain. I did take 2 extra strength Tylenols. The first night, I did feel a little something. You know, it was getting close to bedtime. I'm thinking, oh, the pain's probably going to come at night when I'm trying to sleep. So I popped 2 Tylenols, and that is the only thing I took for this whole surgery. My wound has been looking good. There was really no seepage. We've been changing that every day. The dressing on that looks pretty good. I didn't shower for most of the week after surgery. I just kind of cleaned myself up for the week. Finally took my first shower over the weekend. So going from all them aspects, I gotta say surgery went great. Went fantastic. A lot better than I ever thought it would. Now, I can't say 100% sure it was perfect because, let's see, I had surgery Monday night. Tuesday, hunting around the house, chilling out. I shouldn't say chilling out. I never really chilled out. I was fairly active, even in my recovery days. But Tuesday night, bedtime comes around, and it would be early Wednesday morning, like 2 in the morning. So I got up to go to the bathroom, and I felt something in my hand. My 2 left pinkies. Something's going on, and my left pinky is clicking open. Just all through here, I'm like, what the heck? Me, I'm not the most optimistic guy when it comes to getting stuff done like this. And here I'm like, great, something happened with surgery. They got a nerve or something, and now my 2 left freaking fingers aren't working right. And it is a week later, they are still not working right. All through the good left side of my hand. It still clicks. You can physically hear it click now. And, you know, something's going on through here. According to AI on the internet, they don't think it's from this surgery. If it was from surgery, would have I not felt this right away after surgery? Which I did not. I first felt this come on. I figured it out. It was about 30 hours after my surgery happened. I can still squeeze. I still got all the strength and everything, but everything is just a little bit goofy through here. My wife, she says it's from me holding my phone all the time, and who knows? It could be. So I just don't know if this is tied into my surgery or was it just a coincidence that it happened 30 hours after my surgery. I don't know. Honestly, I haven't even looked into this. Usually I look into all this kind of stuff, and I'm not in the mood to deal with something else right now. So I'm just kind of living with it, dealing with it. Eventually I will dig deeper and see what is going on here. Hopefully it wasn't from the surgery, guys, but I can't say if it was or if it was not. But outside of this, sometimes a little something here and there, little chest area pain, which I haven't had in quite a long time. So hopefully that's nothing but So not 100% perfect, but the surgery itself and the pain and stuff like that, it was way better than I thought. So knock on wood. Let's hope we continue down a good healing path here and get back to normal. As of this hand, hopefully I can figure that out. I don't know. It's always something, guys. Now, I told you I would tell you the other part of this journey. And that part of the journey is I kind of regret getting my initial ICD. I started regretting it more and more after I had it a few years. And I can't say a ton bad about my initial ICD. When I first got it, I did have a significant increase in my atrial fibrillation, so that was kind of a bummer. Outside of that, I haven't had any shocks, like inappropriate or appropriate. I don't think I've had any treatment whatsoever from my initial ICD. And just so you guys know, this ICD, I am not reliant on it. It is kind of there for insurance purposes. It's kind of there if something goes down, maybe this will intervene and possibly save my life. And for the first 9.5 years, I did not need the device to do any of that. After the first year or so, however long it took to get used to it, essentially you kind of forget it's there. I mean, it's always kind of there, but for the most part, you kind of ignore it and you go on with life as normal. So outside of that, I didn't have anything really bad with the ICD. It probably went as well as it could outside of the increased AFib. Now, I think some of the reason I was questioning getting this thing is some of the criteria that they want you to meet to initially get it. Well, some of that has been debunked in my case. And I think probably a bigger reason is, honestly, I am a different person than I was 10 years ago, 9.5 years ago when I initially got this thing. Admittedly, I am more into taking health into my own hands. I am probably more into doing a natural approach going forward in life, and that's kind of the point I am here in my life now. So that definitely might have something to do why I was questioning moving on with this replacement. Now, if I went in today and we looked at all my records, there will be significant scarring from my MRI at 30+%. That is one criteria I would meet for possibly having an ICD. I also have an apical aneurysm, or a noticeable apical aneurysm, but upon doing further research, that can be a reason why ICD would be recommended. But for the size of my aneurysm, I'm kind of right borderline. I'm even a little bit lower than where they would recommend it. So now I could say that that is not a reason to have an ICD, where initially we thought that was a reason. There was some pre-synope we thought I might have had, which is passing out without reason. And I did that like 12, 13 years ago. And after learning more about this stuff, I found out the reason I likely did that is I was prescribed something I should not have been prescribed. And it kind of took me out one night. So that is kind of debunked. I have not had no pass out episodes since then. Usually they will say you need an episode like that a half a year prior or a year prior. So I definitely don't meet that criteria anymore, which we initially thought I did. Another one debunked. We thought, well, the criteria is if you have a very close member that had a sudden cardiac arrest, that would be criteria for you to possibly get an ICD. So my ma, many years ago, she bit the dust. And they did say heart attack. And when I started talking to some of the HCM folks and stuff like that, we were starting to think that she had a sudden cardiac arrest. And from our eyes, it kind of looked like a sudden cardiac arrest. I mean, I don't think she experienced anything beforehand. She just, boom, bit the dust. Which I think sometimes heart attacks you kind of feel coming on. I'm not positive on all that, but all her records, still to this day, after I had this, I've been in the doctors with my mom and her cardiologist, and all the records show heart attack, heart attack, heart attack, which is not the same thing as a sudden cardiac arrest. Now, I still think there's a chance she did have a sudden cardiac arrest, but according to the records, No, she had a heart attack. And that also makes sense. At that same time, she did go in for a stent, which is often what happens when somebody has a heart attack. They end up needing a stent or think they need a stent. So if you really looked at it now, I could say that has been debunked as well. So that's 3 reasons right there. They kind of suggested my initial ICD that I no longer meet. Now I still do meet the significant scarring part. Another significant criteria is if you have a sudden cardiac arrest yourself. And of course, yeah, they will recommend an ICD. I have never had one of them. Another significant criteria for having an ICD is if your left ventricle ejection fraction is like 40 or 35 or less. I don't know if it's 40 or less or 35 or less. Mine, guys, is perfectly normal at 61. So that is not a reason. So the only reason I can think for criteria-wise is maybe my apical aneurysm, though that doesn't sound like it should be. I'm borderline there, and of course, my significant scarring. I went 9.5 years without any ICD treatments, so that's a sign that, maybe I don't need it. Long story short, guys, if I was in there now and I was getting evaluated for an ICD, I would definitely say, no way. Now that leads on to why I ended up going through with this in the end anyway. So my thoughts are this. I actually tried getting a kind of a re-evaluation from my cardiac team. I was a little late on it and they didn't seem interested anyway. They basically called me up and they say what everybody says. Oh, you should have it. It might save your life. Well, it might save your life too, right? So why don't you get one? It might save anybody's life. So generally, I don't like that answer when I hear that. That was kind of my wife's answer. My wife, she don't want me to die. She's like, I want you to have it. It might save your life. Yeah, it might. Again, it might save your life too. Maybe you should go get one. So yeah, I was very close, guys, to cancel it or go in and say, pull it out, cap the lead wires. We didn't get into lead wires yet, which is a shame. Anyway, there's lead wires that go from your ICD device into your heart. But if you guys are watching it this far, you probably already know what that is. And obviously the leads are some of the concerns I also had keeping this in, another 10 plus years. Them are some of the horror stories I see, leads fracturing or coming loose or getting infected, all kind of nastiness. And when you start getting to the point where you need lead extraction surgery, let me tell you guys, that turns into some serious business. And it's really unfortunate if you run into those issues and in the end, you never ended up needing this ICD in the first place. So what are you doing? You're putting something in your body that in the end, you might have not needed. And this device is causing you, a shorter lifespan for different various reasons. And I hate to say it, lead extraction and stuff like that, them are very dangerous surgeries. People die during those surgeries. So that is always in the back of your mind. You didn't meet a lot of criteria this time around that you thought you originally had. The first 9.5 years, you didn't need it. You went along just fine without any ICD treatments. But in the back of your head, you're going for another 10 years of this inside of you, which is another 10 years of chances of something bad happening with the device or with the leads or something like that. Inappropriate socks, those happen here and there. Those can weaken your heart. That would be unfortunate if you had a pretty strong heart already and you have a device in there that is weakening it when it shouldn't be. Stuff like that, Again, sorry I delayed. Why did I go through it? I went through with it. Again, I kind of called the doctor talking about re-evaluation. They're like, yeah, you should get it. It might save your life. They weren't too interested in talking about alternatives. My wife, she kind of steamed. She wanted it. My EP, of course, they want me to go through with it. Everybody wants me to go through with it, except maybe me. So there's been a couple times I talked myself into it. I'm like, I'm just going to do it. I'm going to stop looking, stop thinking about other things. Just go do it, Joe. And then a couple of days later, I'm trying to talk myself back out of it. And in the end, I obviously talked myself into it. I went through with it. And basically it's this. My leads were still good, supposedly, So I'm like, all right, if we can go in there, we can do a quick, clean exchange, cut me out, get that old one out, reattach the new one to the leads, get me back sewed up, send me packing, then I guess I can live with that. And in my mind, who knows, maybe I'll get another 10 plus years as good as last time, and then I'll be happy. But my thought is, if this does start causing me issues, if maybe I get some lead issues, and if for some reason, for sure, if they got to go in there to maybe, a lot of times they'll throw in an extra lead if one goes bad, because it is dangerous to take them out. So they'll just put another lead in there, and they got 3 leads in you, and who knows, 4 leads, however many times that can happen. And I decided I'm probably not going to do that kind of stuff. If something happens to one of my leads and they say they got to go in again and give me a new lead and sew me back up, I think that is the point where I say, no, hopefully that lead is fine and they can leave it anyway, maybe cap them off, take the device out, and I will be done with it at that point. So where I'm at is, if this thing is in here, it's working fine, we're doing good, everything's as it should be, and that's another 10 some years, great, no problem, I'll be happy it's there, fine. But if this thing starts having troubles, or for any reason they got to go back in there for anything, that is the point where I'll say, okay, I'm done with this thing, and I will take my chances without it. Also, if I make it this, they're saying 10 plus years again, if I make it that far and I have no issues and I have, again, no treatments from this device, there's a good chance I'll be in my early 60s by then, and I will say, okay, that's enough. I will live out my life taking my chance without it, and that might be it for this. So give me 10 more years, cross my fingers, we have no problems, knock on wood, and we'll see how it goes. Now guys, I don't know how good this video is. I tried making this a million times. I even tried laying it out on paper. It's been kind of hard to get through. I'm all over the place half the time. But for whatever reason, I really wanted to get this ICD video made. And my message to everyone is, kind of don't do what I did. Do not jump into a procedure without getting plenty of knowledge about it first. Be careful making any health decisions when you are scared. So a lot of times when you are newly diagnosed, you are very scared and you're mentally not making as good of decisions as you probably should be. So you gotta be very careful when you're in that point in your health journey. If at all possible, try not rushing into something. If you can, back off, ease into it, and learn as you ease into it. You will definitely become more comfortable, a little bit less stressed, and the more you know, the better you can make a decision that you can live with. Because I made a decision that I can't really live with. I have to live with it because I made it, but but in the end, I think I gotta say this. I think getting this initial ICD was my biggest life regret. And that's it, guys. If you made it this far into the video, I appreciate it. I don't know if I helped anybody in any way, but for whatever reason, I wanted to get this thing out. Anyway, guys, take care of yourself. Learn as much as you can so you can make comfortable decisions. We will see you guys next time. Take care, everybody.